Okay. This is the platform. These are the platform rules for tonight's session. Firstly, the moderator will guide the process of the session. Then the presenter will deliver information and will be interactive or reserve questions for after. Participants will raise hand to speak and will wait to be acknowledged. There will be no speaking over each other, but speaking in turn. Participants will focus their questions or testimonies on the subsection being discussed. Those are our platform rules. And once again, I would like to congratulate the platform for always abiding by our platform rules and showing respect to one another as we deliberate on the information given. So thank you very much. And for tonight's session, very informative, I hope, but I would like to ask a question. As you can see, tonight's presentation is the clinical application of laser therapy. And it's coming from the standpoint of a company called BioFlex. Now, I want to ask a question. How many on the platform has heard of or experienced laser therapy? You show by a raising of hands if you have heard about it or if you have experienced the treatment. Okay, show it, Alia. Okay. Okay, so I see that some of the platform, the majority of the platform is not familiar with it. But I'm going to introduce to you this evening in line with what we have been giving on the platform over the last 3 or 4 sessions. And that is modality, healing modalities. We had massage therapy. We had reflexology, 2 sessions of massage therapy. And now we're going to look at another modality called laser therapy. And in the past, we've spoken about frequencies, grounding, electromagnetic frequencies and grounding. Well, laser therapy is another type of frequency. It's not electrical frequency, not magnetic frequency. It is light frequency. With that, we should understand that almost every living active energy or a living thing has a frequency, a resonation of frequency. And light has its own frequency also that is spread across the light spectrum. So tonight we're going to look specifically at how light is used in the healing process, the natural healing process, with something that is age old, but has now come to the forefront because of clinical papers, clinical research and papers presented on the positive effects of laser therapy. Another name for laser therapy, you'll hear me say tonight, is photobiomodulation. Photobiomodulation might sound like a big name, but it actually tells you what the light process does. Photo is light, bio is light, modulation is the change. So we have light affecting life changes and all for the better. So we're going to go right ahead and get started right now. And I also have some testimonials at the end, and I do pray that at the end of this, you would have learned of a therapy that can be utilized in place of maybe pharmaceutical, in some cases surgery, but definitely something that is very helpful. The amazing benefits of photobiomodulation, and still sticking on the topic, the clinical applications of laser therapy, because laser therapy is photobiomodulation. Now, as you can see, it is another safe and effective natural healing modality or therapy. And a modality is just a modus or operating, and it's therapy. It's the mode of therapy, mode of curing. And it's being brought to you particularly by the Holistic Health Pavilion Clinic, which I'm responsible for. And we believe in Holistic Health Pavilion that if you eliminate the cause of any problem, there will be no symptom that you have to cure or treat. Get rid of the cause, and there are no symptoms. And that's how we operate, not masking the symptom, but rather going to the root, eliminating the root cause and affecting the permanent cure. And this is being presented for the Rapha Shalom Restoration Ministries International Health Corner, prepared by myself, Alex Ferguson. I am a certified colon hydrotherapist, certified natural health nutritionist, and also a certified photobiomodulation therapist, which we're going to talk about tonight. Our clinic is in Grand Bahama Island, Bahamas. My contact right on the screen, 816-5475, area code 242, and easy email to remember, HHP Natural, Holistic Health Pavilion Natural @gmail.com. So if you have any questions concerning tonight's presentation, you can also email me at hhpnatural@gmail.com. Tonight's presentation contents will be as follows. We'll answer the question of what is photobiomodulation or laser therapy, give you a brief history of photobiomodulation, and also how photobiomodulation works, followed by the benefits of photobiomodulation. And then we're going to listen to some real life testimonials of photobiomodulation and its effectiveness. Then we have our conclusion. We will have our discussions and questions. Moving right into it. What is photobiomodulation or low-level laser therapy? Now, according to the internationally renowned BioFlex Laser Clinic and BioFlex Laser Systems located in Toronto, Canada, photobiomodulation, also known as low-level laser therapy, has benefits proven in more than 4,000 scientific papers and 500 clinical studies. Laser therapy uses superluminous and laser diodes, red and near-infrared light, and that's the emanation, the light coming from the diodes. It's red or near-infrared, and it's used to treat diseased or traumatized tissue with photons or light particles. And these particles of energy are selectively absorbed by the body's cell membrane and the intracellular molecules that's going into the cells and initiating a cascade of complex physiological reactions leading to the restoration of normal cell structure and function. Simply put, it starts the process of a natural internal physiological reaction, causing the body's own internal mechanisms to lead to the restoration of damaged cells and also the proper structure and function of those cells. And it's all being done by light absorption. This is an example of what I am talking about here. Here we have the various layers of the skin, and this is the light penetration of the skin. On my left, what we have here are the different penetrations based on the color of the light. And as you can see, that the near-infrared has the deepest penetration at 780 to 940 nanometers below skin level. And that would be the seventh in a row and the deepest. So when we talk about light penetration to cause internal reaction, this is how deep the light is going to actually generate that response. And now we have another picture on your right that's using a probe, a laser light probe. And as you can see, the near infrared light is coming down to the joints. So the light is actually reaching to the place that it is in the bone and affecting cells within the bones. And as you know, particular cells that are created in the bones have been found to be necessary or a great assistance in the healing process. And we're talking about stem cells. So we're talking about light being able to get down as deep into the bone in order to stimulate even stem cells. And we know that those stem cells can become whatever is needed in the repair process. So that is how light actually penetrates the skin and its depth. Here is a history of photobiomodulation. Now, the therapeutic effects of light have been observed since the 6th century BCE. That's more than 2,600 years ago. So it is being used very early, and it was used in treatment of diseases utilizing phototherapy, that is light therapy. Well, treatments diseases utilizing phototherapy actually won the first of many Nobel Prizes awarded in this field as early as 1903. In 1960, the first laser was developed, which led to the first documentation of accelerated healing in veterinary medicine in 1967. And this was done on, it was not even specific experiment for the light. It happened by accident that the doctor was actually using light on a mice that had lost skin here and had an injury, and he used light on it and noticed that the healing process speeded up almost 3 times faster than normal. And this caused him to dig deeper and actually come up with a lot of what we are going to go over now. By the early 1970s, laser therapy was recognized as a physical therapy modality in Eastern Europe, the Soviet Union, and China. The first appearance of laser therapy in the United States wasn't until 1977. Now, since receiving Food and Drug Administration approval in 2002, however, this modality has gained widespread scientific and clinical evidence-based acceptance, accompanied by advances in technology of the equipment utilized to deliver it. So what it's saying is that since the FDA approval, that there have been many manufacturers of laser equipment for the purpose of healing. Here is a little bit of how it works. Now, when it comes to frequency and resonance, sometimes terms can get very technical. What I want to do is make sure that everybody understands exactly, get a basic understanding of how laser therapy works and its benefits. Because as I said, it can actually help you avoid pharmaceuticals and, in cases, surgery, and definitely help you with a lot of issues that would be prolonged if not assisted in healing, and natural healing is the best. Now, when laser light is directed at tissue, it is primarily absorbed by the mitochondria within the cells, which are responsible for energy production. So we have the mitochondria as a particle within the cell itself, and that is being hit with the light and causing a reaction that is in turn influences other reactions. Now, absorption of the light energy by the mitochondria stimulates the creation of adenosine triphosphate, ATP, which is the cell's primary energy source, allowing cells to work harder and repair tissues faster. I just want to mention that again. The absorption of the light energy by the mitochondria within the cell stimulates the creation of ATP, adenosine triphosphate, which is the cell's primary energy source, giving greater output for cells to work harder and repair faster. It speeds up the repair process. Then, because of this, it triggers what is called vasodilation, which is a widening of the blood vessels, leading to improved blood flow to the treated area, delivering more oxygen and nutrients to the damaged tissues. That means it's like the injury has its own internal medical team coming to the site of the trauma or where injury is or whatever needs to be addressed and doing whatever is needed to correct the situation and get things back to normal. Wonderful. And in this, what triggers the vasodilation is something called reactive oxygen species, ROS. And it acts as a messenger coming from the mitochondrial reaction, acts as a messenger that helps to stimulate working with the ATP to help the cells work even harder and faster. Continuation of how photobiomodulation works. It works by stimulating cellular processes. Laser reduces inflammation by modulating the release of the inflammatory chemicals, thus reducing inflammation. Now, the body releases inflammatory chemicals to come to the aid of injury. And sometimes those inflammatory chemicals overwhelm the area, and that's why we get the inflammation, the swelling. Well, laser helps to actually modulate. It's a control center. It helps to create a control center. So those inflammatory chemicals are not made or stay at that spot for too long a time that will cause inflammation. And doing that automatically reduces the inflammation because there's not as many inflammatory chemicals there for it. Then the combination of improved blood flow, reduced inflammation, and the release of endorphins. Yes. Photobiomodulation also influences the release of endorphins, the body's natural painkillers, thus contributing to pain relief. So this is the natural pain relief portion that comes from the photobiomodulation. And this is a diagram of what was just explained. Yeah, this is we're in the cell. Yeah, we're in the cell. This is the cell membrane. And here we have the mitochondria. And we have the near infrared light coming in, hitting the mitochondria. And the mitochondria reacts to release the ATP, the adrenaline triphosphate, and also the ROS, the reactive oxygen species, that hits the nucleus, influencing gene transcription or the harder work that causes the recovery. Another benefit for those of you who are familiar with nitric oxide, this process of the near infrared light hitting the mitochondria also causes the release of nitric oxide. And for you who know about nitric oxide, it is a biodieselator. It opens the arteries so that more blood flow goes through. So here we have the process of how the infrared light actually causes the body to react in a way that reduces inflammation, helps in the rapid repair of damaged tissue, while at the same time allowing the individual not to rely on anything outside of what its own body is doing for the natural healing. Now, these are some conditions indicated for photobiomodulation, and you'd be shocked to know the amount of conditions that this treatment can actually assist with. We have soft tissue and sport injuries like ligament sprains, tendon tears, muscle strains, tendinitis, contusions. And these are injuries that normally athletes would incur. And even the weekend warrior would actually come across some of these in their weekend training and activity. And a lot of times when going for treatment for these, you are given pharmaceuticals, and the process is not as quick as you would need it. For instance, what you might get is muscle relaxants, painkillers, and stuff like that while waiting for the body to repair itself. Here are more conditions that are addressed by photobiomodulation. The inflammatory conditions, for instance, the plantar fasciitis, that nagging ball that sometimes develops in the sole of your foot that causes you to walk so gingerly. Well, photobiomodulation is the perfect tool to actually reduce the inflammation caused by plantar fasciitis. Also, Achilles tendonitis, rheumatoid arthritis. Yes, rheumatoid arthritis is also treated naturally with the photobiomodulation. Bursitis. And as you can see in the diagram on the right, we have condition application from head to foot and from foot to head. It helps with so much. And we're going to have a testimonial at the end from the inventor of this particular module of laser therapy. His name is Dr. Khan, a Canadian, who was a medical doctor that actually developed this from to treat his own injury, and using it with the research has developed a protocol that is so effective. Now, when it comes to treating wounds, even the difficult diabetic wounds, look at that. That's a diabetic wound. They're very difficult to heal. That wound there was like that, and even worse for some 6-7 years. It's a little bit better there, but as you can see from the skin around the visible wound, that it's still in the healing process. Well, all of that was once raw. Okay, and it healed very slow and it's very difficult. And the individual went to many clinics to try and deal with it, especially dermatologists and others, to no effect. Okay, but this wound was completely healed in a short period of time once photobiomodulation was applied. So when it comes to wounds, and that's, like I said, that is a diabetic wound, very difficult to treat. So a regular wound would be even easier to treat. It helps with compression, the venous stasis, the diabetic wound, and also trauma that you would receive in an accident, whether it was impact or a trauma that just developed from a fall or something like that. Okay. And yes, there are still more conditions that are indicated for utilizing the photobiomodulation module. A lot of people have suffered carpal tunnel syndrome, rotocuff injury, adhesive capsulitis, that's the frozen shoulder, endocondylitis, that's the tennis and golfer's elbow. Yes, right in the joints. Then we have stress fractures occurring in the bones, lymphedema, that's the swelling at the ankles and other places on the body, fibromyalgia, gout, migraines, and also post-surgical healings. All of these are conditions that can be addressed using photobiomodulation. And these are by no means a stretch of the imagination. Those thousands of research papers and clinical studies have actually proven this, so that it is not a speculation, but rather a fact. This is an effective and natural healing module. It also, as we said, in how it works, it reduces pain. It's a pain reliever, natural pain reliever that actually does the job without doing damage by blocking pain receptors as pharmaceuticals do, giving the false impression that everything is okay, causing more damage and strain on whatever the pain is supposed to be blocking. It also helps with the restoration of natural range of motion. I don't know if there are any physical therapists or massage therapists on the platform tonight, but this is a tool that will definitely enhance what you do, because it does help the range of motion extensions. Also, it accelerates natural healing process. Big benefit, no side effects. It is non-invasive. That means it's not like surgery. It does not penetrate your skin, except the light, that is. You're guaranteed a faster recovery period. It is an alternative to medication. There is no adverse reaction to its application. It's very safe for children and very safe for elderly. It's safe also for treating autoimmune disease. Here we are in clinic, and this is a picture of me treating with photobiomodulation therapy a 12-year-old national swim team member. He was suffering from muscle strain in the rectus femoris muscle, right on top of his thigh, running down to his on the inside down to his knee. And the treatment that he received was 5 half-hour sessions over a 2-week period. And the patient was healed within the 2 weeks and can go back to the training that he couldn't do prior to. And this without any type of pharmaceuticals at all. Now, this is another picture of the diabetic wound that we saw earlier. And this is it at a certain phase, because as I said, and this is what was done in my clinic. The wound was much bigger than this. This is the earlier photo. And we've had worse wounds. We have had wounds where the flesh is exposed right around the foot, completely exposed. And we safely used the photobiomodulation to help with the healing recovery. Well, on the left, you have where that wound, that difficult to heal wound, and the darkening around it, where the poor blood flow was. And on the right is the complete healing of that wound with the lightening of the skin area, showing fresh blood coming into that area, which helped with the healing. Now, one of the things that has benefited me in helping persons is the fact that when a modality like this is combined with good nutrition that actually enhances healing, you have 2 mechanisms that are working together to enhance an even rapid form of healing. This being a diabetic wound, his diet needed to be in lines for a diabetic, where much of what influences the diabetic condition, the type 2 diabetic condition, is eliminated from his diet, and other food items are introduced to help bring back that blood sugar balance that helps, so that when the photobiomodulation is applied, you have a double effect, so that the results that you see on your right actually takes place. Now, in conclusion, photobiomodulation presents itself as a natural alternative to some surgeries, but most of all, to many indications of pharmaceuticals. It is safe and has proven results. Photobiomodulation stimulates the body's own healing mechanisms to bring relief from pain, inflammation, and discomfort naturally. The information that was provided this evening is based on the use of BioFlex laser systems, BioFlex being the name brand of the laser system and protocol that I have used and have been trained on in order to show the results that I'm showing now. It has its own unique treatment protocols. BioFlex laser therapists can be found in many countries right now around the world. Or if you are a chiropractor or physical therapist, massage therapist, or naturopath, and want information on certification, the number and address is provided below. because it will indeed help you to help others more effectively and without the side effect or having to undergo costly surgery. So they would come to you, and I am telling you that combining the use of the module with proper nutrition enhances the healing process, and it's all natural, no side effect. Okay, so I hope you were able to get this, and I'm sharing this information to help sharpen even the therapists and the other practitioners that are on the platform. And I want to encourage you that if you are not, and this is, if you feel led to, that that you are led to natural healing, to help others, you have the compassion and the kindness to prepare yourself to actually or equip yourself so that in helping you can be extremely effective, especially if you are utilizing faith with what you are doing. It causes everything to work out perfectly. And now I want to share some testimonials. So I want to move from this screen and go to another. I do hope all of the information that you received was helpful. Now we're going to look at our, and first we'll hear from Dr. Fred Kahn, and he was the manufacturer of the BioFlex module.
Place the treatment head behind you. Sideways.
Had an MRI that showed mini strokes. I had concussions in my early 20s, teens, and at about 60-some, I lost my memory and I couldn't work, and I lost my vocabulary. When I used to speak contemporaneously without any problem, I couldn't put together 2 or 3 sentences, much less argue in court, much less think fast enough to make an objection. So I was done.
That's better, thank you.
And you can lean back and relax.
Great. I was in a motor vehicle accident and had a concussion and whiplash, and I was dealing with the aftermath of that. I was having a lot of difficulty, and my naturopath called me up and said, I think I may have found something.
This year we'll be treating probably close to 250 cases of some type of concussion. So you learn very rapidly, and I have a good team.
Now, what are the areas, perhaps you're part of your daily routine, that you find you are improving, you're gaining something on that side?
My balance. I'm able to walk my dogs a little bit now, whereas before I was very afraid of falling down. My speech was terrible. I was having a lot of problem trying to find words, and sleeping, I'd get an hour or 2 and then I'd be up.
And what exactly did happen to you?
I was wrestling at school in a tournament, and I took a knee to the right side of my face.
A 15-year-old high school student, his coach noticed some of the symptoms of concussion.
What are the main symptoms that you experience at this time?
Stuttering, severe headaches, and very high sensitivity, painful sensitivity to the light. So we have initiated the course with a laser treatment, and after his treatment number 3, this young man stopped stuttering. He started reading books. He was able to take off his sunglasses.
With his extraordinary energy, he replaced 4 other surgeons.
The young people may have had a concussion as recently as a week ago, but they've been out of school, they're swallowing aspirins or other analgesics, and they're dysfunctional and may even occasionally have seizures. And the parents are very vigilant today, and they bring them out, and it's dramatic how rapidly they respond.
In your own words, please tell me, how does it feel?
It took us in total 15 treatment sessions to discharge him from our care.
Feels a lot better, no longer stuttering.
He was back to normal life, normal daily activities, back to school, normal communication.
So it's comfortable, not too tight?
No, it's not too tight at all. Yeah, I tried the traditional intervention through a university hospital in the Washington, D.C. area, and they basically said there wasn't anything they could do. My brain had become very noisy, and I couldn't think. I tried to have a thought, and I'd start that thought, and before I ended that thought, maybe a thought as long as one sentence, I'd lose the front end. And here I could sit, and all of a sudden the brain wasn't noisy anymore. I wept. It was astounding. I don't know any other way to put it. I mean, I just relaxed, and my mind was quiet for the first time in years.
Oh,
You know, just like
okay, we're going to continue with just one or two more testimonials. That was from the headquarters in Toronto, Canada, Meditech. Now we're going to look at some other testimonials. This one coming from NBA player Jerome Williams, the Raptors.
BioFlex Laser. I originally heard about BioFlex Laser. A good friend of mine, also the inventor of BioFlex, and a lot of we had a laser machine there that really helped our this in the brain, and doctor after getting an MRI and I get I was and laser treatment and having surgery. Immediately results, more range and the pain and I back link and pain free. So I do laser work because it doesn't just go on knees and that shows us thighs, hamstring, calf. After you do like a sign and start my so that's after 12 years of retirement and to play 45-year-old 26 and that's impressive. Oh, that I think that's cool within itself. That's kind of work.
Here, was for BioFlex, and then I'm Mary, and I have a 50-acre farm here with a lot of dogs and horses, donkeys, a llama, sheep, goats, pig, and I would say most of them had the laser at one point or another. Most of the horses here are rescued, so there's only a handful that can be ridden. So the others, some people call them lawn ornaments, but really it's just a full-time job, us taking care of them so that they have a good quality of life. So if anybody knows horses, things happen with horses. They get into trouble really easily and get cut up, especially if they panic. And so I would say the horses have used the laser more than any other animals on farm. The BioFlex laser, it just works. It's very effective. The biggest thing for us, if we had more time, we'd use it more.
Okay, we're going to look at one more from a therapist.
I massage therapist. I try to use BioFlex Laser Therapy as much as I can in my day-to-day practice. My name is Frank. I'm a registered massage therapist in Toronto doing mobile massage therapy. I've been using the BioFlex lasers alongside of my massage therapy practice for the years that I've been a therapist, and we've had a lot of success. During the time the lasers on, we can also work massage therapy in other compensatory areas. We can focus on movements, specific stretches, and things like that. So we're just kind of like, I'm not a person just like lean on and do nothing. I like to work other areas as well. So I think it's really cool how it gives me the ability to be versatile and utilize more than just one technique. But what I like about this product is that it's versatile to treat someone with like a really old chronic injury, as well as someone with some that's more intense and kind of like more immediate. I think lasers are really cool. It's really cool to see like a modern day start to use light therapy, and it could be kind of like in a really polished innovative product like this. And I'm just where is it going to be like 10, 20 years from now.
Okay. And that platform is presentation on photobiomodulation. What are your thoughts?
I'm really impressed.
Yes.
No, seriously.
Mhm.
I'm really impressed.
And Imavik, you have a lot of practitioners right in your area.
And you know what? I've never even heard about any of them.
I know.
It's almost as if it's being hidden.
Yeah, actually, it is a therapy that has been present and it's gaining traction. And the more practitioners are aware of it and how it could help with the treatment of injuries, the more it gets out there. But anybody who has been touched or being helped by low-level laser therapy will brag about its results.
I'm a little kerfuffled, just to put it this way, about the way it affected that doctor with the stroke who had the stroke. No, I don't know whether he was a doctor. The guy with the stroke, yes, who suffered a stroke, and how much he benefited from the treatment.
Yes.
I'm surprised that I don't hear a lot more about it in the instances of strokes, you know?
And that is because a lot of the information, even and what I would call surface information that was presented tonight. Thank you, Zahaba. Yeah, even the information presented tonight goes so much deeper, but a lot of people are still not aware of it and its benefits. But look at this. We when we go to sunlight, are able to receive the light from the sun as it penetrates our skin. It goes into the cells and causes the process of actually converting vitamin D, creating vitamin D from the physiological process of that light coming in, and that's one frequency of light. It's more yellowish. There is light that goes deeper and create even deeper effects. So everything around us affects us. And that's why we are almost living in a balance. And anytime we are out of balance, sickness and disease takes place at the same time. When we can create the balance or help move toward balance, then everything calms down. And we should also always try to balance both physical and spiritual, as we are individuals, both physical and spiritual. That balance is what gives what is called the holistic balance. But definitely we are affected by so much things around us that can be used for our benefit. And Yao is definitely showing us.
I'm super impressed. Will you be sending out any recordings of tonight's session?
Yes, we will. Yes, we will.
Okay, I want to show a couple of people.
Yes.
That if you send that out.
Yes, ma'am. Yes, ma'am. And this is information for everybody on the platform and anybody who receives the recording. Photobiomodulation is a natural healing modality that can only benefit and not harm. When used in conjunction, like I said, with nutrition, or even with reflexology, that patient with the diabetic leg that I showed you, well, while he was receiving photobiomodulation on the wound, I was administering reflexology to increase and open up the blood circulation into the area. That worked well with what the photobiomodulation was doing in actually creating the nitric oxide to open up vessels. So yeah, two things working for him at the same time to speed up the process. And this is the type of thing that this can do, either adding as a standalone or in conjunction with other natural therapies.
I'm a little bit surprised that they haven't created like units that could be used at home based on photobiomodulation that let's say so many people have bone pain and hip pain and all of that. I would think they would have created units that you could use in the home to treat that sort of pain.
Okay, very good. You were reading the process. This is a laser pad with diodes on it. You have about 120 light diodes that emit red and near infrared light for the application. And this is part of a personal home care use. So if you contact BioFlex Meditech, they do have personal units that can be utilized in the home for that process.
You won't believe how impressed I am. I'm so impressed with this. No kidding.
I am so happy that you are, and I hope everybody else is impressed too, because this is a way of cutting back on pharmaceuticals, a way of cutting back on surgery, a way of cutting back on side effects.
For instance, sorry, I didn't mean to speak over you. In the cases of sciatica, that's like so many people suffer with sciatic pain, that would be a huge help,
Yes, and I have used it for sciatica. I've used it for gout. I've used it for arthritis. I've used it for knee pain, ankle pain. I've used it for migraine headaches. The range is so wide. Now, the cost of a session could range anywhere from $90 to $125 an hour, but you'd normally need more than one session. And when the sessions are combined, the cost per session is reduced so that it is affordable for the person taking it. And when you have some practitioners who see what they do as ministry, sometimes an individual can be treated just as a benefit and a blessing from Yah. Anybody else want to say something about the laser therapy or want a question? Anybody?